sincere gratitude and appreciation to the staff of the Department of Physiology, Faculty of Veterinary Medicine at the University of Puta, Malaysia, for giving me the opportunity to record the physiology practical classes. Actually, these practical classes will be useful for me when I go back to Sudan. It will be useful for our students over there. Therefore, I might sometimes explain in Arab, as far as Dr. Ali is going to do some editing for Malay. So it is not going to affect the general idea behind this recording. Before I start, لابد لي أن أترحم على روح فقيد مغفور له بإذن الله الأخ حسن عوض معلة الذي أخذت منه كثير فيما يخص بالجانب الفني العملي، فنسأل الله أن يتغمده بواسع رحمته وأن يجعل هذا العمل أيضا في ميزان حسناته. إن شاء الله I will try to explain as much as possible in Arab, and I will back later on. I think our staff in the Department of Physiology at the University of Khartoum, they are going to make some improvement for this recording for our students. These practical classes, which is dealing with experimental animal physiology, usually we start with the demonstration of experiments on muscle contraction, and whenever you talk about the muscle contraction, usually we are supposed to explain the device which is used for demonstrating a variety of physiological phenomena, which is the physiograph, and also we have to explain about the experimental animal used for demonstration of different muscle contraction and applications on muscle contraction. Usually in these practical classes we use the frog as experimental animal, and as we know, the frog and amphibians are using these biological study experiments because the tissue of these animals can resist manipulation during the experiment, which is due to its low metabolic rate. The experiments you are going to demonstrate, you are going to use acetic gastrocnemius filtration from the frog. This gastrocnemius muscle and this acetic here will try to dissect this muscle properly and to demonstrate the simple muscle contraction, and also going to demonstrate the effect of increasing the strength of the stimulus on the muscle contraction and the effect of temperature on muscle contraction, and also we are going to demonstrate the effect of fatigue and the effect of increasing the frequency of muscle contraction. في كل هذه التجارب بنستخدم عضلة الكاستيكينياس ونستخدم جهاز الفيزيوغراف. And the physiograph is basically composed of three main components. The physiograph in three main components, which is a transducer. Transducer ده أعتقد هو النجس. 60% بيقولوا transducer النجس، أو هو عبارة عن جهاز يقوم بترجمة or conversion of form of energy to another form. For example, the mechanical energy will be transformed to electrical signal, and this electrical signal will be amplified أو يتم مضاعفتها ليسهل قياسها. After amplification of the electrical signal, it will be reproduced أو يتم ترجمتها عن طريق reproducer, which is basically a large galvanometer, عبارة عن galvanometer, which the arm of the galvanometer is the form of ink pen, so that when the electrical signal, the electrical signal is expressed as a deflection component of the physiograph, the reproducer, which record the signal, the electrical signal. It's in the form of a galvanometer, and the pane, the deflection of the galvanometer, which is a pane of ink pen used to record the electrical signal. So the deflection depends on the signal, electrical signal, which the electrical signal depends on the mechanical contraction as a result of muscle shortening. The preparation of the sciatica subcutaneous muscle from the frog, usually we handle the frog and then we render the frog insensible to painful stimuli. So pithing, which is a sort of anesthesia, are going to destroy the nervous center, the nervous system, the brain and the medulla oblongata, the spinal cord by insertion of needle of the seeker. Usually we insert the needle of the seeker at a point, the junction of the skull and the first cervical vertebrae. So we insert the needle through the foramen magnum forward to destroy the brain, or backwards in the vertebral canal to destroy the medulla oblongata and spinal cord. And when the needle is in the right track, usually the hind limbs paralyzed. Hind limbs of the frog paralyzed. So after that, we put the frog on the frog board, and then we make an incision of the skin around the waist of the frog, and we remove the trouser of the skin. We just pull it downwards, and after that we open the abdomen and we remove the visceral organs cranially. When we remove the visceral organ, we see the vertebral column, and at the end is two whitish colored sciatic nerve. Then we cut the vertebral column at this level, because we left 2 or 3 vertebrae below the cut, and we always have to keep our preparation moist in this Ringer solution. Ringer solution is a solution containing sodium chloride, potassium, calcium. This solution resembles the normal body fluids of the frog. So we keep our preparation wet with Ringer solution, and we continue this section by making the cut the bone at this level until we cut the pelvic symphysis. We have two preparation. We keep one for later use, and then we keep it in a Ringer solution, and then we follow the sciatic nerve, clear the sciatic nerve. We do blunt dissection until it reaches the gastrocnemius muscle. You have to do the dissection carefully, because if the nerve is damaged, the conduction will be impaired. So we dissect our preparation, and finally it will be like this. We have the muscle, the gastrocnemius muscle, and this is Achilles tendon. And this is part of the knee joint, and this is the sciatic nerve, and this is a terminal part of the vertebral column. We keep our preparation wet, and then we tie a thread around the Achilles tendon, and we mount our preparation in the front cord, and we tie the thread to the myograph, which you can later in the physiograph, the procedure. And as I tell you, we have to keep our preparation always with using calculation. And after that, we have usually in this practical use electrical stimulus. We use electrical stimulus to stimulate our preparation, and we prefer electrical stimulus and other types of stimuli because we can control the strength and the frequency of the stimulus. This is why we do this experiment interpreting the strength and the effect of increasing the frequency, so we can demonstrate the effect of as we increase the strength of the stimulus, we see the change in the amplitude of contraction, and also we record muscle contraction when we increase or change the frequency of stimulation. Usually we apply the electrode, the stimulator. For the stimulator, we have the electrode. You can apply the electrode to the nerve so that the stimulus will propagate as an impulse to increase the muscle and the muscle contract, or we can apply the electrode directly to the muscle. So this will be direct stimulation, and this is indirect stimulation. Can be very mubashir or can be mubashir. After we fix our preparation, then we start showing the simple muscle contraction by applying the optimal stimulus for contraction, and then we get the record for simple muscle contraction, which look like that. So this is the contraction, and this is the relaxation. So if we write from here, this will be the contraction period, and this is the contraction period. This will be the relaxation period. Usually when we apply the stimulus, the contraction will not start immediately. There is a time. This is known as the latent period. It's the time taken by the chemical reactions to release the energy for muscle contraction, and also it's the time taken by the impulse to propagate along the nerve. So this is known as simple muscle contraction. After that, we will try to see the effect of increasing the strength of the stimulus on muscle contraction. And usually we start increasing the voltage of contraction. When we start from zero, at zero there is no response because there is no stimulation. But when we increase the stimulus gradually, we get a response. The first response is known as the minimal stimulus or the threshold stimulus, and as we increase the strength of the stimulation, the response will decrease gradually until we reach point the response will not increase. So this point is considered as the maximal stimulus, and these are sub-maximal or sub-maximal. After that, when the response is not changing, all these stimuli are considered as supra-maximal. And the supra-maximal stimulation has, even if we increase the strength of the stimulus, the response will not change because all the motor units on the muscle fibers are contributing to contraction, so we get the maximum. After that, there is no any further response, but it might go down as a result of fatigue. Also, it illustrates the effect of increasing the effect of temperature. So we get our first record at room temperature, and then after that we add or we flood the preparation with cold drinker solution, and at the time when we stimulate the muscle, we get this response. So the effect of temperature, and when we decrease the temperature, the response or the amplitude of contraction is decreased. And when we warm again our preparation with warm drinker solution, we get another the contraction will be also improved. And this is most probably due to the effect of temperature on the chemical reaction or the enzymes in the muscle and affect the release of energy. Also, we are going to illustrate the effect of fatigue. We are going to take a record from the muscle before fatigue. And after that, we make the muscle for we give the muscle several stimulation, and after a time, we stimulate the muscle and you see the change in the amplitude and the amplitude decrease, and the duration of the contraction cycle prolonged. This might be due to depletion of energy, and also might be due to accumulation of lactic acid. Finally, we are going to illustrate the effect of increasing the frequency of stimulation on muscle contraction. Usually, when we give stimulus, one stimulus at a time, we get single responses like that. For example, if you give stimulus every second, you get one simple muscle twitch or simple muscle contraction. But in the same time, if we increase the frequency of stimulation, the contractions or the responses will be close. So we get for example, at the same time, we can get they become more close to each other. So as we increase the frequency, they become more close until they become fused like that. And when we increase the frequency further, before the muscle relax, we get another contraction, and this is known as summation. So before relaxation, we go, and as we increase the frequency, it give staircase contraction, and as we increase further, the contraction will be incomplete. This is known as incomplete tetanus. And if we further increase the frequency of the stimulation, the muscle will keep in contraction for a long time. This is known as complete tetanus. So we are going to show all these responses by the muscle, and we are going to explain how the different parts of the physiograph, and we are going to show also the dissection, teething and dissection of the septic gastrocnemius. I mentioned this is a stimulator, electrical stimulator. It gives electrical stimulus. ممكن يكون تنبيه manually give single stimulus, ويمكن أن يكون continuous مستمر على حسب المعدل المحدد بمفتاح frequency or rate of معدل التنبيه. This is an electrode. عن طريق هذا الالكترود يأتي التنبيه الكهربائي للبريبريشن بتاعتنا. هنا الضفدع زي ما شايفين هذه gastrocnemius muscle. This is a gastrocnemius muscle. Sciatic nerve بيطلع من هنا to supply to innervate the hind limbs. So if we apply the electrode to this side, the muscle, the hind limb will contract. The hind limbs will contract. So you can show how to control the strength and how to control the frequency. بسيطة. فنحن في الأول نبدأ starting with slippery. The frog by single stimulation, as you see, contract as you give stimulation. So if we reduce, the response is reduced also. Okay. See the small. When you reduce the strength, slow. Then you increase the strength, the response is small. Okay. you can also demonstrate the effect of increasing the frequency. So in this case we put at continuous. Every second we get one response. Okay, we increase gradually to 2. See, as we increase gradually, the response increase. As we increase, you see gradually, it's continuous, increase the frequency until we get a tetanic contraction. You see, it's complete tetanus. Okay. So we can control the strengths of the stimulation. يمكن التحكم في قوة التنبيه من هنا. وكذلك also you can control the frequency. يمكن نتحكم في frequency rate of stimulation بهذا المفتاح. ويمكن نحدد نوع التنبيه single, continuous or external trigger بهذا المفتاح. So this is stimulator. This is a stimulator. After we make the dissection of the frog, then we attach the thread. We attach the thread after the dissection. We attach the thread here, and so the transducer, as a result of contraction, the muscle shortening to pull this one here. Then this mechanical action will be translated. So this is where we go to the preparation here, the muscle. We fix the muscle by the pin, and then we tie the thread, and the thread will be fixed here. So when the muscle contracts, there is muscle shortening, and it will pull. It will pull from here. This one will be pulled down. So through the transducer, this will be transferred to the transducer coupler, and it will be converted to electrical signal. This electrical signal, the processor, will be magnified or will be multiplied. Because the amplification will be so that the signal will be strong enough to be to deflect the pen of the galvanometer. And as I mentioned, the reproducer is the form of large galvanometer. So as a result of the electrical signal, it will be changing the voltage will deflect the needle. So when the needle is deflected, it will record the muscle action. So the muscle contraction will be recorded. We can control the speed. We can control the speed of this paper. And as you see here, this is a unit. This shows the time, the speed per second. The speed per second in centimeter per second. So we can control the speed according to the experiment. We start by preparing our sciatic gastrocnemius muscle preparation, and first we start by handling the frog and by fitting. Okay, we handle the frog. We press the head down. So at the junction between the first cervical vertebrae and the skull, there is a depression. So if we push the needle forward, it's going to destroy the brain, and if we push it backwards, it's going to destroy the medulla oblongata and the spinal cord. So first you press, then you push. When the needle is in the right track, then the frog will paralyze. So you push the needle inside, so you see the legs are paralyzed. It's an indication that the medulla oblongata is destroyed. So we put the frog on the frog board, and then we have to keep the ringer solution so that when we start opening, we keep our preparation always wet. We start the dissection. We use sharp scissor, and we make an incision. Around the waist. Yeah. Okay. Make an incision.
on the skin. Skin around. Okay, then with a piece of cloth we hold the skin, and then with one pull we remove the trouser of skin. Okay. Okay, we always keep the we have to keep our, so this is a gastrocnemius muscle. This is a gastrocnemius muscle. This is a gastrocnemius muscle. So we open the abdomen. And then we remove visceral organ first. Okay, concentrating. So this is a sciatic nerve. So this is a vertebral column. The vertebral column, and this is a sciatic nerve. This is the sciatic nerve. This one. This is a sciatic nerve. This is a sciatic nerve. Okay. So we cut from here. Yes, we leave. Okay. Concentrate here. Okay. This is okay, this is a sciatic nerve. This is the terminal part of the vertebral column. Okay, then we cut the urostyle bone. This is the urostyle. This bone. We start cutting this bone. We cut the bone. Cut longitudinally, divide into two preparation. We open here. Also we cut at the pelvic symphysis here. Okay. So we keep this preparation. We put the scissor just below the nerve, and then we cut the pelvic bone. Pelvic bone. and at the dorsal side we press these two muscle, and this is until the vein is clear. This is a sciatic nerve. This is a sciatic nerve, whitish color. This is a sciatic nerve. This is sciatic nerve. To follow the nerve, this is the sciatic nerve, this one, here. This is a sciatic nerve, whitish in color. Okay, we do blunt dissection so that to avoid the damage of the nerve. We cut only when we are sure the nerve is clear. Okay, after that we lift the nerve like that, and then we cut the tissue below. Okay, we do it carefully until we reach the knee joint. Protect the nerve like that. We cover the nerve and then cut all this tissue. Okay, cut out the femur and then free the muscle, and then we cut tibia and the muscle is now free. We remove the Achilles tendon. Okay. Achilles tendon. Okay. So this is now our preparation. The sciatic nerve. This is a terminal part of the vertebral column. This is gastrocnemius muscle. This is Achilles tendon, and this is a knee joint. Usually we fix our preparations of frog board this point. Okay. We have to always to keep our tissue or our preparation right towards finger solution. We tie the thread, fix the thread around the Achilles tendon. Just make a knot first. First we make knot. Follow me. Okay. We make a knot. Then we tie the Achilles tendon tightly. Okay. Okay. Then we fix our preparation to the fix this needle. Then we tie this thread again. Down. Graph. Then we put the electrode, apply. This is now to apply the stimulation to the nerve. So this is indirect stimulation. See, when we stimulate, the muscle start contraction. Okay. So directly we apply the electrode directly to the muscle and also stimulate. This is direct stimulation. After that, we can do all our application. You can see the effect. We can record normal muscle contraction, simple muscle contraction, and also we can record the effect of increasing the strength of the stimulus by increasing the strength of the stimulus from here, and then we see the effect of different level of different voltage. Okay. We start by demonstration of simple muscle contraction. We are going to stimulate our patient and to see recording of simple muscle. So we are going to adjust the speed to 2.5 and then we start movement and we stimulate. This is give simple muscle contraction. Okay. Here this record shows simple muscle contraction. The muscle during contraction go up, and this is relaxation. So this is the contraction cycle. And this is simple muscle twitch or contraction. هذا المخطط يوضح انقباض العضلة. واضح انه هنا الانقباض وهذا هو الانبساط، والمسافة من هنا إلى هنا هي عبارة عن contraction و relaxation period. يمكن أن أيضا أن نوضح في التأثير زيادة التنبيه على انقباض العضلة. فنبدأ بالتنبيه نغير المنبه إلى درجة الفولتج هنا كما شايفين، والآن في زيرو. لذلك لما نعمل أي تنبيه ما في أي ريسبونس لأنه زيرو. لكن لما نزيد التنبيه gradually ما في ريسبونس، أقل من بين 0 و 1 ما في ريسبونس. بنزيد شوية إلى أن يصل وين. في اللحظة اللي بيحصل فيها أول تنبيه هذا هو يعتبر المينيمال أو threshold stimulation، لأنه بدأت تنقبض. فنبدأ تسجيل المينيمال ستيمولس. أوكي كده هنسجل أول ريسبونس اللي هو شايفينه دي أول ريسبونس اللي هي بنعتبره دي المينيمال ستيمولس. ونزيد إذا كان في 1. أوكي نزيد gradually نشوف في 1.5 is okay. Let's keep here 1.5. واضح انه التنبيه بدأ او الريسبونس زاد شوية. This is 1.5 نزيد شوية ل 2. نشوف this is 2 نزيد ل 2.5. نشوف this is 2.5. نمشي ل 3.5. for at 2.5 but 3.5 it looks same, so this one is considered as maximal stimulus والقصوى التنبيه الأقصى وده التنبيه الأدنى ويعتبر هذا this is considered as supra maximum ما في أي زيادة ريسبونس لأن كل المسلز شاركت في كل المسل يونتس الموتور يونتس كلها شاركت في الانقباض وبالتالي ادتنا أعلى انقباض at 2.5 ودي بيعتبر سوبرا لأن already كلهم كانوا involved في الكونتراكشن. هذه تجربة بسيطة توضح تأثير زيادة التنبيه على انقباض العضلة. The effect of increasing the strength of the stimulus on muscle contraction. Okay, and that effect of the strength of stimulus on muscle twitch, muscle contraction. يمكن أيضا أن نسجل تأثير الحرارة على انقباض العضلة. فمثلا بس الآن يمكن نعتبر إنه هذه رينجر سوليوشن في درجة حرارة الغرفة at room temperature. هنسجل أول انقباض على في درجة حرارة الغرفة at room temperature. Let us see the effect. Okay, this is considered as okay. This is at room temperature. Temperature. Cold. الآن now we add cold ringer solution. To see the effect of cooling on muscle contraction. Add cold ringer. See the effect of cooling on muscle contraction. Just stimulate. Okay. الملاحظ هنا بدأ الامبليتيود اوف كونتراكشن يقل والكونتراكشن سايكل او الفتره بتاعت الانقباض والانبساط اخذت زمن اطول هنا في الروم تمبريتشر. This is called ringer. لما ضفنا الرينجر وهو في درجه حراره منخفضه لاحظنا انه الارتفاع او الامبليتيود اوف كونتراكشن decreased and the contraction cycle also prolonged compared to at room temperature. When we add okay, we see the effect we add warm ringer solution.
then we stimulate. When we add more ringer نبدأ أيضا الكيرف يرتفع والamplitude of contraction increase. This is more ringer solution. So the effect of temperature called ringer decrease the amplitude and the contraction cycle increase also. This is called ringer also. This is at room temperature, and here this is warm ringer. Effect of increasing the frequency of stimulation on muscle contraction. We fix the voltage and we fix but we change the frequency. Okay, now we are going to demonstrate the effect of increasing the frequency of stimulation on muscle contraction. So we start by applying a single stimulus every second. So this is single stimulus every second. Then we increase the frequency to 2 every second. So it's coming close. Then we increase to 3 every second. The contraction become more fused. Then we go 4 every second. It's more close to each other. Then we go further to 5. It shows staircase contraction. And we go further to 6. Sort of incomplete tetanus. And we go to 10. Is complete. This is complete tetanus. Okay. Chord you see here, you have one stimulus every second, then we increase to 2 per second, 3, 4, 5, 6, and 7 per second. At this rate, we have this complete, it's incomplete tetanus. It's complete tetanus. This is staircase phenomena. Here this is fused contraction. This is simple muscle twitch. Of all simple muscle contraction. So as we increase the frequency of the stimulation, the contractions they come fused together until the reach point there is sustained contraction. This is known as complete tetanus. The effect of exercise on muscle contraction. When we start stimulating the muscle, at the beginning the muscle is active. The contraction. Then, as we increase with exercise, it goes down, and the contraction cycle will become prolonged.
as a result of fatigue. So if we compare between the first record here and this record at the end, you observe that the amplitude of contraction decrease. Amplitude of contraction decrease and the contraction cycle prolonged. The contraction cycle prolonged if you compare with the first record. So this is an indication of the depletion of energy in the muscle, and it might be also as a result of accumulation of lactic acid. Practical classes for today, and I would like to thank Mr. Kufli and Mr. Zur and Juan Rasmawati for conducting this practical class. Thank you very much.